blood pressure?
Yes.
Yeah, okay. The community hospitals are there for the rehabilitation after people have been to the acute units. So we take transfers from the acute units, which can be anywhere, Papworth, Addenbrooke's, but equally James Paget, Norfolk and Norwich. We're here also, we take admissions from the GPs.
I think why we call it a GP unit is because partly it's operated by a GP practice, so GPs come in and care for the patients within the environment. We don't have acute consultants like they would in the James Paget Hospital, for instance. So the patients can be looked after by their own GP.
So what about this bruising? Did you land on your face?
I landed on my face, yes.
With it being a community-focused hospital, we felt that's quite important because patients then can still have the consistent approach that they've been used to with their own doctor.
4 weeks, 5 weeks? Lizzie's quite typical. She's an elderly lady, completely self-caring, was out shopping and fell over, bang, on the pavement. 37-1. She can't manage at home, obviously. Why? She's got these plaster casts on, but she doesn't warrant an acute bed in the James Paget Hospital. So she went there for the initial treatment and then was transferred to us. It's for patients that don't require anything acute, no surgery, their conditions aren't life-threatening, but they're not quite ready to go home yet.
Still within normal limits.
Then you've got your palliative care patients that are physically dying. There isn't, a lot of help out there. So if they haven't got any family or anything at all, they come into here. And some people just prefer to die in hospital. And it's not like a busy hospital here. It's quiet and peaceful. And you have time to sit with your patients, spend time getting to know them and things like that.
The acute hospital has its place, but there needs to be that transitional place really for people to become fit to go home, and the community hospitals provide that.
I was diagnosed with MS in 2000, and recently I've been having problems with falling around quite a lot, and that's how I got involved with these guys, because we were calling an ambulance out to help me off the floor, and they said, would you like us to put you onto the falls prevention, which I'd never heard of. So they got involved and they've done loads for me.
There is a lack of awareness of what community services are out there, from both a patient level and a staff level in the acute trust. It's understanding of the services as well, that just because people know about them, they don't necessarily know what they can do to help.
It's helped me because from day one with Angela come around, we'd sorted out the things I need, the helps with stuff in the house like handrails and stuff, and eventually I got this lift up pillow, which is the things what I had to call the ambulance people out in past to do it. Now I've got one at home that I can use. It can be used just by me and the wife, so if I have a fall in the evening I can get sorted, which is great. So I wouldn't have had any of that. I would have carried on as we were. It meant me phoning 999 every couple of months, which I don't want to do. I want to be at home and manage myself as best I can, which I try and do.
Rainer Green is a health and social daycare centre, and we cater for people with dementia care. We mainstream, which could entail people with MS or problems at home that they need to come in for respite to give their families a break. We're a day centre to promote people to keep in their homes and to prevent admission to hospital and residential care. We go out and pick people up from 8 o'clock in the morning, and people come in and they have cups of tea and coffee on arrival and chat. People come in and play music and talks and different things. Today we're providing activities based around the theme of Halloween and Guy Fawkes. We've been making pumpkins for the table decorations and table mats. We do the old things that everybody loves, cards and dominoes, and we provide tea and coffee and lunch and general entertainment really. We also have input from social services, district nurses, the surgery, which is just across the road, OT, physio, and the Patrickstead Hospital is also on site. I think a lot of people think, oh, there's not a problem, and they don't realise that there may be a problem, and so we kind of highlight the concerns that we pick up on through healthcare professionals, and then it's acted upon, whereas a lot of elderly people tend to, oh no, I'm all right dear, I've been like this a while, I'm fine, and quite often we highlight things and then that prevents long-term problems. We've got quite a good name, I think, in the area, and it seems to work, and I'm very proud to work here.
Palliative care is quite a specialised area of care, and it's quite a privilege to be in with patients at that stage of their life, and our aim is to make life as easy as we can for the patients and for their carers and their family.
I think they're a small group of very professional, well-trained and genuinely caring people, which I think is fantastic. And it's nice to know that, you know, I've got to know the entire group, so whichever one of them or whichever pair of them comes, I know them both and can even remember their names, which for me is pretty good. So I think that works really well.
In palliative care, continuity is very important to both the patients and the carers.
I take quite a lot of looking after, and I don't think I'm always the easiest person. I get a little grumpy and a bit demanding on occasions, so more help would be good. But otherwise, I can't fault the hospice at home staff and the care that they give, which I think is brilliant.
The idea of the virtual ward is to keep people with long-term conditions out of hospital. We see patients that have got 2, 3 or more long-term conditions, patients that are frequent attenders in hospital, A&E or GP service. Our remit is to visit those patients and to basically keep them out of hospital, to try and relieve GP visits and help the patient to be in control of their own medical needs, really. Helping them to recognise when the first signs of a chest infection, the first signs of a urinary infection, and what to do when they get those first signs.
I was so pleasantly surprised at this virtual ward. I thought, what a great idea. You know, this is really marvellous. It gives you that protection, that feeling of, you know, someone's on the ball with you and they're there. And if you want them, they'll be there. The matron can fast track any medication you need, any contact with the GP. She would be quicker than anyone else.
Most people would prefer to be in their own homes. The time spent with the patient is what the job's all about.
The medical treatment, second to none. It's absolutely superb. And no other county could give what this county is giving. That has been a godsend, and if that were taken away, I don't know what I'd be back in hospital.